So yo, what's up everybody? Myself Anubhav and welcome to Nursing Med Easy channel. In this video, we are gonna do conduction of heart in a simple way. So make sure to like this video and share it to your friends. So what is conduction? So first of all, there is electric current that move to the muscle of heart, basically myocardium. So there is electric current that move from the muscle of heart myocardium in order to tell it to contract. So first thing you need to remember is that heart muscle is specialized. When we look under microscope, all the heart muscles are connected to each other and we get a little gap present in between like this, and we got little gap in between. This is important because we are going to find these cells like any excitable cell of a body like neuron for example, and rest have the negative charge associated with them. So they have negatively charged associated with them. Interesting. And what happen if you want this muscle to contract? You need to turn the negatively charged to the positively charged. So if you have to contract this muscle, you have to turn this negatively charged to positively charged, and we call this depolarization. So what is depolarization? It is when the muscle of heart go from the negative stage to positive stage. So this thing is known as depolarization. So you can write this: depolarization is when negatively charged will convert into positive charge. So the depolarization step, it all begins. It all begins at here, at the arteria. There is a specialist type of tissue. We call it as sinoarterial node. Special type of tissue we called sinoatrial node, where sino refer to sinus. It set the sinus rhythm. This is pacemaker of heart. SA node is pacemaker of heart. Set rhythm about 60 to 100 beat per minute at rest. At rest, it is negatively charged. But what does it spontaneously go positive, like I told you before? If the spontaneously go positive, it will send a long wave. It will send a long wave of positive charge throughout the muscle of heart, especially muscle of arteria. But it will do as a node will send a long wave of positive charge to the muscle of arteria. Remember, two arteria at top. Here it is two arteria at top, at two ventricle down at the bottom. A muscle associated with SA node send wave of positive charge through arterial muscle in that manner, so it spread that positive charge throughout all the moving way through arterial myocardium. Interestingly, if we do ECG, we put sticky electrode to hand, feet, across the chest. It pick up charge change like AKG or ECG does. Number of lead often are used in ECG. So we have a reference lead. It is a lead 2, usually looking at heart from apex toward heart. So like this is a reference lead. It is looking toward heart from the apex part. Think you are looking at heart from apex to base. You are looking at heart from apex through to base. You are basically what I'm trying to say, you are reference lead. And if you are seeing that positive charge will come toward reference lead. Anytime positive charge come toward you, we call depolarization. We get pump on lead. So firstly nothing happened, that the SA node spontaneously depolarize, send positive charge toward lead, and you get a positive deflection on the ECG like this. You will get a positive deflection on ECG like this. So you guys, positive deflection. And what happens here is a fibrous tissue that separate arteria from ventricle. So fibrous tissue is separating arteria from ventricle and stops this positive charge. So here we get another flat line because of this fibrous tissue, the transfer of positive charge stops. Thus we get a flat line from the ECG. That what happened, we have another specialized tissue here. We have another specialized tissue similar to SA node that set between arteria and ventricle. So we call this as a arterioventricular node. So what we call this as a arterioventricular node or AV node. Arterioventricular AV node. We call it AV node. This has little pause for second, like 0.2 second, and then it send positive charge to specialized fiber. So it will send the positive charge to specialized fiber we called bundle of His. So it will send the positive charge to the bundle of His. So it is bundle of His. So this part is bundle of His. See, AV node will send positive charge to first left side. First it will send to left side, and then it will send the positive charge toward right side. The bundle of His will send wave of positive charge in a manner like on left side. We find the left side the positive charge to go toward the lead, and we found a very big bump up. So here also we see that this positive charge is initially coming to this lead. So when initially it is coming toward the lead, so we will see a big bump like this. Okay, so we'll say big bump. Then after some time we'll see initially it is going toward the lead. After some time we'll say it will go away from the lead. It is going away from the lead, move away from the lead. So we get a dip down, a dip down. So here we get like this line. So what happened when the whole heart get depolarized? It contract, all get positive. When all get positive, the heart contracts. So now let's take a look on what different lines or wave on ECG represent. So first, when we have this bump, first bump, it was majorly followed by arteria contracting and pushing the blood down. So first bump we see on ECG is of arteria contraction, depolarization of arteria through SA node. When we have this big bump, see, when we have this big pump, it is followed by ventricle pushing down of blood. So here ventricle will depolarize, and after depolarization, as I already told you before, there will be contraction of ventricles. But next thing, we need to reset the heart. When the whole heart is depolarized, we need to make it negatively charged again, but in opposite direction. When negatively charged go from reference lead to arteria, then again we have up bump. So it is known as negative resetting. What negative resetting is? Basically, the polarization repolarization is negative resetting of heart. We get positive charge towards the reference lead, but here resetting of heart, negative resetting of heart is different. It will go like this way, negatively charged. Okay, so negative charge go from reference lead to artery. Negatively charged thing will go, and that thing will known as negative resetting of heart. So now let's take a look on ECG. So this is first bump is known as P wave, that represent arterial depolarization. After P wave, there are Q, R and S wave. Q, R and S wave. And collectively it is known as QRS complex, that represent ventricular depolarization followed by ventricle contraction. And after P, Q, R, S, we will have T wave. The T wave means negative resetting of heart, which I told you now. If the positive charge is converted, Hana, when the positive charge from negative charge, the heart will change into positive heart, then the term we use is depolarization. But if there is positive charge and we have to negative reset the charge again, it is known as repolarization. So as I told you, depolarization is, I told, from negative to positive. So let's write here depolarization. Depolarization is basically negative to positive, whereas repolarization is from positive to negative, is from positive to negative. So remember, S a node depolarize the artery followed by arterial contraction, and AV node depolarize the ventricle through the bundle of His and follows ventricular contraction. After ventricular contraction and arterial contraction, whole heart will be depolarized. So to repolarize it, we will do negative resetting of heart. So I hope your this topic of heart is clear, conduction of heart is clear. So if you like this video, make sure to subscribe my channel. Bye bye, take care.